the last national data vault that was opened showed that FCT was leading in skilled birth attendants by 102%. And if we have 102% women giving birth at a skilled birth attendant place, that means 102% babies are receiving immunizations. So it's a ricochet effect. It is not acceptable. This administration has zero tolerance for maternal mortality. So I'll focus on that. The minister will not go and build mother and child centers, for example, and say we want to tackle maternal mortality. When our people believe that giving birth in a traditional birth attendant home is the only way, when our people believe that if you have your baby by cesarean section, it is an abomination, when our people believe that they're just saying they will give us free health insurance, it's a lie. When we get to the hospital, we will pay a lot of money. Why am I building hospital? Even worse, there's the Japa syndrome. We do not have there's practically an emergency in human resource for health. The city is growing. The health demands are higher, but doctors are not coming here. Rate of living is high. Remuneration. I am happy to say the government is working on adequately remunerating doctors, but honestly, it is difficult to put a figure to someone's passion to save a life. Because to save a life, if someone fainted in the studio now and we all had to empty our pockets to save his life, I'm sure nobody will think twice. That is what a doctor does every day. And we are doing it actively in Abuja. And we do hope that this will translate to verifiable indices, figures, and we'll be able very soon to call Abuja the hub or the capital city of healthcare. I mean, yes, we are not working on infrastructure, but things are done in stages.
I mean, I was going to talk about the remuneration bit for doctors, because that's been in the news, hasn't it? Doctors and nurses of the FCT asking for better remuneration, threatening to go on strike from time to time. What's the Mandate Secretary Office, in collaboration with the Minister, what's the plan for the doctors in this Abuja?
It would amaze you. The budget is a public document. For 2024, it was planned to employ 982 healthcare workers and also pay all arrears. And I am happy to say in 2024, recruitment arrears allowance, uniform allowance, was paid for the first time in about 8 years. The allowances of those, there are some minor administrative issues, and this is not unexpected. FCT was under the Treasury single account. They were being monitored, financed, accounted for. Human resource was under the federal government. Now, technically, we have a civil service commission that is separate from the federal government. There are teething works in transferring federal doctors separate from state doctors, in picking up salaries, in picking up all the areas that the doctors are asking for. About 60% of them is they have paid some, they have not paid some. They have paid some that started work in 2023. They have not paid those that started in 2022. I believe these are teething administration problems, and the doctors are aware that the minister is working hard on this. He has been able to avert a strike once, and he's very open to conversation. And I do believe that there's no situation that we cannot sit down and negotiate and talk when it comes to remuneration. I want to use this opportunity to give a big thumbs up to the doctors in this city, in FCT. They do give a lot, in spite of how difficult it may seem right now. And I believe that they see the star at the end of the channel with the minister. The minister has a lot of plans for the health sector. Dealing with health means it will do things you people can see, but it doesn't mean he's ignoring health. We are winning awards in immunization coverage. We are winning awards in antenatal care attendance. We are winning awards in different competitions within the 36 states. And this can only happen if Mr. Wike is supporting the health systems. It's not where we want it to be, definitely. Far from it, but we're working towards it.
All right, we do have to go on a short break, but before we do, my condolences to you and to every mandate secretary, and indeed everyone in the FCTA, mourning the death of the head of service for the FCT. I mean, that was a tragic loss, and our prayers are with all of you, and we know that you're all mourning right now. But we'll go on that break. When we come back, we'll take a look at some of the plans that are already in motion. Like we started this interview with me telling you about the fact that the FCT minister said MRIs and CT scans were going to be purchased and going to be sent to the hospitals. So now we're going to be looking at the quality of healthcare in the FCT. And we'll talk about that when we come back from this break. Please stay with us on Dateline Abuja. We'll be right back. Welcome back to Dateline Abuja. If you've just joined us, Dr. Adedolapo Fasawe is with us, the Mandate Secretary on Health for the FCT. Thank you again for making out the time to be with us. All right, you talk about access and how infrastructure helps access, and then welfare of our doctors and the plans for all of them. Let's talk about the quality of the healthcare in the FCT, especially when it comes to primary healthcare centers, or even secondary and tertiary. Where would you rate the quality of healthcare that we're receiving right now? Especially, I'm not talking about private hospitals, I'm talking about government hospitals for the people at the grassroots. What kind of healthcare is being made available for them, and what's the plan to upscale it?
Thank you very much. Abuja is a very interesting topography in terms of health-seeking habits. I had to take time to study the knowledge, attitude, and practices of the people. We follow tradition a lot.
Yeah.
And to break that takes a different approach. What this administration has done to improve healthcare delivery is change mindsets, use community settings. We now use religious fathers, we use market leaders, we use political leaders, we use the chiefdoms, we use the emirs to preach a message that come to the hospital, there's health care. I must agree with you that they didn't just stop coming. They stopped coming because they were not receiving what they were meant to receive, quality health care. And this had happened
over the years.
And they had found ways out of it, which was okay for them. Now, this administration has come in, and we are determined to give quality health care. Yes, the minister announced it, that a CT scan and an MRI are in the process of being procured for the FCT. This is true. Procurement process takes a long time for us to do it right and get the right technical specifications, and also know that this MRI and CT scan is sustainable. It can take care of itself. We have human resource that can operate it we have energy, renewable energy, light that can back it up, we will not invest hundreds of millions of naira into a machine and an electrical surge or a bad batch of electricity just booms it.
FCT residents have had to turn to traditional ways of curing one thing or the other. Even things like cancer, we have people who are medicine men in Abuja who say they can cure all kinds of things. In fact, there was a time when the pangolin market was we had to do programs to protect the pangolins in the FCT because people were killing these animals and using them for all kinds of medicinal purposes. And the reason was two things. Access to quality healthcare was almost non-existent. And then secondly, when you do get quality healthcare, it's too expensive. You have to sell your land, you have to sell your properties to be able to access proper quality healthcare. What are the plans to change that?
I am very happy to talk about quality. When we came in, the Presidential Task Force on giving people key performance indicators, the administration of President Bola Ahmed Tinubu of the Renewed Hope is very serious about data. And it's amazing to me what this data will do for this nation when we start to use data to make policies. So now, every single MDA, ministry, department, or agency has a performance indicator and milestones that we tick along the line. There's a committee in the President's office that is responsible for this. And what they gave us in FCT health sector was increase the number of people on health insurance by 1,000 a year in the next 4 years, and also build more primary healthcare centers. So at 1,000 a year, I am happy to say that we're in our second and a half, third year, and we have increased by 328,000 people. And why are more people coming to the health insurance scheme? We deliver. Before now, you'll be a health insurance patient, and once you see the doctor, they give you a piece of paper with prescription, go and buy. No, we're on electronic medical records. And once you're a health insurance patient, all the medication written for you must be administered. If it is not available in the hospital, there's something called emergency purchase. And with insurance, I think it's word of mouth that spreads this. Every general hospital, subnational, states that conducts a cesarean section, the federal government refunds that hospital for every money it has spent on cesarean section.
So I said the passenger. So the patient doesn't have to pay anything.
The insurance will pay.
Okay, so if you're insured, you come with your insurance
yes.
paper.
However,
yes,
insurance is 27,000 per annum.
Okay.
To do a cesarean section costs much more than that. We know how insurance is. Now, I have a key population in Abuja, pregnant women. So we spend a lot of money on insurance. If it's CS, the federal government will refund me, not the extra money I have spent, the whole money I have spent on health insurance if that patient is registered on health insurance. There's a lot to be seen. But if we fail to plan, we plan to fail.
Yeah.
We're in planning stages, and we will be back here to show you impactful, tangible, and exciting results.
Thank you so much, Dr. Adedolapo Fasawe, for being with us on Dateline Abuja. Good luck with all the work you have ahead of you. And we'll be checking up on your office from time to time.
I need it.
I know. It'll be okay.